Hey there, welcome back to How to Medicate and welcome to this new video on how to use Sertraline. This video is part of a new video series on mental health problems, and for all of you interested, check out the new playlist in the description. For those of you I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions, which is the whole point of this channel. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get started. The generic name of this medication is Sertraline and it's sold under the brand name Zoloft and is available as a tablet or a drink. Now then, how should you use this medication? If you want to use Zoloft as a tablet, make sure to swallow it completely with half a glass of water. Do not chew on it and do not break the tablet, as this might decrease the effectivity of the drug. If you want to use it as a drink, then make sure to measure the exact amount with a measuring cup. Drink that, rinse the cup with water and also drink that water. It's important to always dilute this drug with water or any other drink. Another tip is that you take Sertraline at fixed times, which makes it less likely you forget a dose. The duration of use depends on many factors, among which the severity of your symptoms and the indication of use. And if your symptoms improve with the use of Sertraline, you usually have to keep using it for 6 to 12 more months. However, if you do not experience any benefits within 2 to 4 months after using this drug, then please contact your doctor, as another drug might be more suitable for you. Now then, when to use Sertraline? It's part of a group of drugs called SSRIs. These can be used to treat severe medical conditions like a depressive episode or the prevention of a depressive episode, panic disorders, obsessive compulsive disorders, social phobia, or a post-traumatic stress disorder. Before we will discuss the correct dosages, let me first say to always use the prescribed amount and frequency your doctor gave you. I will just provide you with some general guidelines here. Furthermore, the actual dosages you will need to use will be adapted throughout your treatment based on the blood levels of Sertraline you will be having and the symptoms you will be experiencing. When treating a depressive or an obsessive compulsive disorder in adults, your doctor might prescribe you with a starting dose of 50 mg once a day. At weekly intervals, this can be increased with 50 mg depending on your symptoms, eventually up to a maximum dose of 200 mg once a day. When treating a panic disorder, social phobia, or a post-traumatic stress disorder, the starting dose usually is 25 mg once a day. After a week, this is increased to 50 mg once a day, and if necessary, the dosage can be further increased with 50 mg at weekly intervals, again up to a maximum dose of 200 mg once a day. Now, Sertraline can be a very effective drug, but unfortunately it also can have some side effects. I will discuss the most common ones here, but if you're looking for a complete list, then ask your pharmacist or check your leaflet. Very commonly, so more than 10% of all patients will experience insomnia, dizziness, fatigue, somnolence, a headache, dry mouth, nausea or diarrhea. And commonly, which is 1 to 10% of all patients, might experience a decreased appetite, agitation, anxiety, nervousness, depression, and so on. Regarding safety, it's safe to combine Sertraline with any type of food. However, be careful with alcohol, as this might increase the dazing effects that Sertraline can have. When considering driving, it's usually safe to drive when using Sertraline. However, it can cause you to become drowsy, sleepy or dizzy, and if you experience any of these side effects, then please do not drive, as this can be dangerous. And as always, we end off these videos by taking a look at the safety of Sertraline when you would be pregnant or breastfeeding. And unfortunately, Sertraline can be dangerous in both cases. Especially for pregnant women and their unborn babies, it can be dangerous. Therefore, always discuss this with your treating physician. Now, I hope you know now how to use Sertraline, but if you have any questions, let me know in the comment section. And for those of you who want to keep learning, check out the playlist in the description or somewhere up there. Furthermore, I want to thank my sponsors on Patreon. Thank you, Sebastian, who is an investor tier supporter. And if any of you want to become a Patreon as well, then please check out the link in the description. Now, before we end this video off, let me remind you to leave a like. This will help out the channel tremendously, and consider subscribing. It will speed up my process to 10k subscribers. And just to give you a little insight in my YouTube statistics, 0.9% of my viewers is subscribed. And I think we can do a whole lot better than that. So please surprise me, subscribe to the channel, and as always, I will see you next week with a new video. Bye bye.